What are 3 ways to manage your bipolar disorder that don't involve psychiatric medications? My name is Dr. Dotton. I'm a board certified adult psychiatrist, and I talk a lot on this app about the importance of targeting root causes of mental illness rather than solely covering up symptoms with prescription medication, although this is definitely still an important part of the treatment plan for many. So I'm going to talk about 3 things that can hopefully help to manage and ideally put into remission your bipolar disorder. So I'm going to talk about 3 things that, in addition to medication, if that's part of your treatment plan, can be used to help manage your bipolar disorder symptoms and hopefully put into remission. So number 1 is going to be circadian rhythm therapy. Circadian rhythm normalization for those who have bipolar disorder is very effective in helping to prevent manic and depressive episodes. So what does this look like? It means making sure that your body is awake, active, eating when it's daylight out, and that it's sleeping, resting, digesting when it's dark out. How do we do this? So I can talk more about this in another video, but some ways to help regulate your circadian rhythms are to avoid screens for certainly the hour before bed, but ideally after it gets dark outside. Avoid eating late into the evening. Ideally, you would eat only when it's light outside. Starting your day with exposure to bright sunlight or light therapy if you don't have access to that. Going to bed and waking up at the same time every day, consolidating all of your sleep to one period at night rather than napping during the day, and avoiding caffeine in the afternoon. These are just a few of many ways that you can help to do this. Number 2 is going to avoid toxins, right? And specifically, I'm thinking about substances that we know can be associated with developing or triggering episodes of mania or psychosis. So this can include things like marijuana, cocaine and other stimulants, methamphetamine or prescribed stimulants, hallucinogens and dissociative agents. I recommend this for everyone, but especially those who are vulnerable, meaning that they've had a mood episode in the past and or they have a strong family history. And lastly is going to be diet. I can talk so much about diet and its role in mental health, but I'll start with saying that if we look at things like insulin resistance, inflammation, and oxidative stress as being some of the sources of psychiatric symptoms, including mood lability, manic episodes, depression, then we need to think about food and how our food is either contributing to or reducing these things. So broadly, cutting out ultra-processed foods, cutting out things with refined sugars and carbohydrates and refined seed oils, and primarily focusing on a whole food diet, that's going to be something that pretty much everyone can benefit and what I see as step number 1. Now, there can be other interventions also that can be helpful. So if someone has an intolerance like gluten or dairy, this can actually have a significant impact on someone's mental health due to that underlying inflammation, as well as gut and microbiome issues. For those who have insulin resistance, they may do better with carbohydrate restriction. Or for those who may have other gut issues or have sensitivities, it may be helpful to eliminate other common irritants, things like nuts, seeds, legumes. And the very far end of this would be something like a carnivore diet, which is essentially the most extreme elimination diet that you can use. And the other thing we talk about is a ketogenic diet. We have lots of evidence to show that a ketogenic diet can actually bring bipolar symptoms and psychotic symptoms into remission. So if you want to hear any more details about any of these things, like the ketogenic diet or different ways to regulate your circadian rhythms, then let me know in the comments below and I can do another video about that. I'm also putting together an email list for those of you who are interested in my content because they may have future courses or offerings and I want to be able to communicate directly with you all about those things. So if that's you, then send me a DM with your email and I'll see you in the next one.